Welcome back to On the Beat, everyone. I'm over here with Sharon Turner and Lisa Dement from Monroe Sleep Disorder Centre and Clinic. And today we're talking all about sleep apnea, whether you have it or what are the signs of it. Welcome to the show, ladies. Sleep apnea. It's a phrase that's thrown around out there as if it's just people who snore. What is it?
Actually, it is when the tissue in your neck occludes your airway or partially occludes your airway once you're sleeping.
What do you mean the tissue?
Well, you know, it can actually be how you're made anatomically, you know, have a smaller airway, made smaller by large tonsils, adenoids, or it can just be that you're just overweight and you know, as you get older, your muscles are not what they used to be, and they tend to be less taut, and so you have an occlusion in the back of your throat.
Okay. How do they know they've got sleep apnea?
Normally, you care if I take this? Okay. Normally, your bed partner will complain about your snoring, and that's the number one symptom. And because you're actually interrupting their sleep, you never feel rested. You never, you know, feel like you are ready to meet your day. If you're falling asleep in social situations, church, in the car, that sort of thing, or if you have a headache first thing in the morning, that can be a big sign.
Really?
But the number one sign is snoring, and that usually sends you out to be tested further.
Okay, interesting you say that. Now, is it a genetic issue if your mum or dad have it, or uncles, or is it hereditary within your genetics?
You are more likely to get it if your parents had it.
Is it something that we would, if we live alone, is it something that we would know? I know all of a sudden I might sound like I have a big snort and I wake myself up. Is that a form of sleep apnea, or just because I'm overtired and just all of a sudden went into a deep sleep?
Well, the gasping for air, waking yourself up, jerking yourself awake, those type things are some symptoms that go along with sleep apnea. You know, sleep apnea, as we talked about, has to be a pause in your breathing for 10 seconds or more that causes a decrease in your oxygenation.
Okay.
And if you live alone, if your dog has suddenly moved to the next room, or if you know, your neighbors are complaining of your snoring, then you need to have that checked.
I got you, neighbours. Well, it must be loud if the neighbours are hearing you. Can children get this?
Yes.
Really? At what age?
Usually 30% of children have some type of sleep disorder, and that can start even from a preemie.
What tools do we use to fix or cure sleep apnea?
If you're an adult, the first thing we tell you is to lose weight.
Okay.
And we also can send you to a specialist who can actually evaluate your tonsils and your adenoids and see if there's anything,
really?
any surgeries that they can do. Sometimes they even have to debulk the back of the tongue if you have a really big tongue.
So it's surgery?
Yeah, surgery can correct some of the problems. Also, if you have a really big overbite or an underbite, or if you have retrognathia where your chin is back a little bit, those type things can be corrected with surgery also.
Wow.
We do try to treat you with positive pressure first.
What's the positive pressure?
Or CPAP.
Oh, that's the machine?
The least invasive.
The unattractive machine.
Yeah, but it works.
Which most of your partners that sleep in the same bed are happy you have.
Yes.
Exactly.
Are those machines covered by insurance?
Yes.
Okay. Now, do you do sleep clinics, or can people come in and do how they lay in bed and you watch them and you video them on?
Well, I'll let her take that one. She'll tell you exactly what's involved in the sleep study.
Usually we monitor you overnight. You come in about 7:30, and we let you get acclimated to the room. Of course, we set the rooms up to look like your house so that you'll be comfortable. You're like a regular bedroom or a hotel room. And then we put a few wires on you and belts so that we can monitor your sleep.
Okay, and that's over a 12-hour period, I would assume?
Usually 8.
Okay, interesting. Well, normal night's sleep, right? All right, well, we really appreciate both of you coming in. Thank you for your advice. I hope it helps everyone at home. If you want to find out more information about Monroe Sleep Disorder Centre and Clinic, there it all is up on the screen. Give them a call. These ladies will take care of you. Back after this short break.